pick up from what Colin said. I totally agree, but highlight that the Mater Hospital, which is a city hospital, has undergone service change over the years, and service changes did actually happen.
It's one of the 3 hospitals the Belfast has.
But I completely understand the point, though, and this is where the issue lies. Information, we don't have it, we can't scrutinise it. Therefore, where do we go from there? And speaking as someone from the Alliance Party who has fought for transformation, who has stood up in council when other parties have voted against something, actually just raised our heads and voted for it because we knew it would work out better, and there are areas in which it absolutely illustrated that has been the case. But it gets difficult if we do not have the information and we can't supply our constituents right across Northern Ireland with the confidence. But I respect that it is highly political, and that is not your fault. So I just want to ask how many teams internally are actually working on these different issues. And if it wasn't highly political, do you actually have a plan based on consultation with experts, with clinicians, with communities, how you can fill the gaps? I'm not asking you to tell us what they are because they haven't got approval, but do you have it?
So issues, you mean the reset plan? Or
not just reset plan, reconfiguration, all of it, because they're all one. They're all different names, but they're all together.
See, the thing about the reconfiguration, most of that, I suspect, or actually I know, is in trusts. They'll be working on those because most of them are for trusts to take forward. So there is some regional work obviously happening. So I lead, for example, on neurology and stroke. So my team, we're doing work on stroke reconfiguration at the moment, which is to conclude in probably next year. Which obviously could be controversial. We don't know yet. I don't know what the outcome is going to be. So that's clearly work that's going to happen. But if that leads to a closure of even one stroke unit somewhere, that will be highly controversial. Absolutely. So some of that work is happening, yeah, for sure.
And in terms of the teams that are working on these issues, because you just said you were diverted to the reset plan, and we have the reset plan, reconfiguration, the hospital networks, and all different plans on reform, tackling waiting lists. But how many different teams are working?
The first time we came up to the committee, I did try and address that because I appreciated your point that we can't cover everything here, and the last thing we wanted to do was say, that's not me, that's somebody else. So we did give a list of all the different key strategy, key areas of reform, new ways of working, with a contact name within the department. Now, obviously, that's a year ago we've sent that, but I recognise that if you did want to deep dive into a certain area, or you wanted to see how many different areas do you cover, there was that document.
But
so there is lots, and it was pages long.
I don't know how many. I can't remember off the top of my head, but it sounds like there is a high number of people.
There's a lot of people working on policy.
Has there been a high number of consultation going on with clinicians, with administrators, and is that constant?
Well, all of these things are always clinically led, so clinicians have to be involved in all this.
The issue is, in my view, political. There's no change because it's political, and we'll be much further. And I do think that we need the information in order to scrutinise, to actually sell it to our constituents. I mean, the Minister said that in the chamber, and I cannot remember the date, that there would be elective, I can't remember the exact word, elective surgery more at SWA because there was empty theatres, empty wards. Mm-hmm. Where are we on that? Those promises, they help to illustrate that we will continue to have jobs in your community. We will continue to have transport to get you to A&E if you need emergency surgery. And I appreciate that things are political in the decision making, but information needn't be political. And I say that there is a responsibility for everyone to actually just realise that if we are going to fix the healthcare system, we can't be using it as a political football. Thank you.
Thank you. Just before thank Diane,